starting. All right, and we are live. Hello, everyone. Welcome to Black Life Amplified. It is the virtual town hall series, formerly known as We Good. We have rebranded and come back with a new name, a new platform, and a new set of guests to help educate and inform you on COVID-19 and all things Black life and the Black community, especially within the Twin Cities of Minnesota. My name is Brittany L. Wright with Insight News, and I'll be your host for today's town hall. Before we get started, I want to give a very special thank you to our sponsors and our partner organizations who all come together and make this town hall possible. Up first, we have the African American Leadership Forum, the Minneapolis Foundation, and North Point Health and Wellness, as well as Children's Minnesota. Those are our sponsors who make this town hall possible. And then we have our community partners who all come together and produce this town hall behind the scenes and keep the show going. Those partners include the African American Leadership Forum, North Point Health and Wellness, Children's Minnesota, Insight News, the Minnesota Spokesman Recorder, and Minnesota Community Care. Today's virtual town hall series is focused on unpacking the impacts of COVID-19 and its impacts on the community. So we're going to talk about the vaccine. We're going to talk about how effective it is, how accessible it is, and if it's right for you and your family. It's our hope that by the end of this conversation, you'll be able to make an informed decision for you and your loved ones on if this town hall or this vaccine is right for you. So joining us on today's town hall, we have Adriene Thornton, who is a nurse and infection preventionist with Children's Minnesota. Welcome back, Adriene.
Thank you.
Also joining us is Lachelle Cunningham, who is the founder and CEO of Healthy Roots Institute and Chelle's Kitchen. Welcome, Lachelle. Glad to have you.
Thank you for having me.
And joining us once again is Dr. Zeke McKinney, who is a faculty physician and clinical investigator with Health Partners. Welcome back, Dr. Zeke.
Thank you for having me.
Super excited to have you. Also joining us is Dr. Nathan Chomilo, who is a pediatrician and Medicaid medical director. Welcome to the town hall for the first time.
Thanks for having me. Glad to be here.
Glad to have you. And joining us in just a little bit will be Dr. Kevin Gilliam, who is a family physician with North Point Health and Wellness. We're going to go ahead and get started, though, with Adriene. Adriene, can you tell us what's going on with COVID? What does the data show us? Is the pandemic getting worse or getting better? Because I honestly can't tell.
It depends on how you look at it. The data is good. So the number of COVID cases is decreasing. The number of hospitalizations is decreasing. The number of ICU admissions is decreasing. The number of people vaccinated was increasing. We've kind of hit a plateau now, but everything is going in the right direction. What that says to us is that what we've been doing, which is wearing our mask and keeping our social distance and doing hand hygiene, is working. That was not necessarily followed as much as it could have been, for instance, during the Thanksgiving holiday. And I think after the holidays, people kind of, they put on their boots and said, okay, we're going to do this. We're going to do what needs to be done so we can make it through this pandemic. And so the good news is that it's working. We just need to keep doing what we're doing. Even though we're vaccinating more people, we still need to wear our mask and do our hand hygiene and maintain social distance until we get enough people vaccinated.
So, but there are new strains of the virus. So what exactly does that mean?
So viruses kind of go through mutations all the time. For instance, the influenza virus, it mutates every season. And that is why we have to change the vaccine every year to make sure it's effective against the strains that have started to appear. And the same thing is happening with COVID-19. So it's just going through, normal virus mutations. What is most important is where those mutations occur, because the vaccines that we have available now, they target the spike proteins, which are the little spiky things that come off of the coronavirus. And so if the mutations occur there, in theory, the vaccine should still be effective against those mutations. Of course, we won't know for sure until we have people vaccinated that have had the mutation or the variants, or we test it in the lab. And so I know the scientists are looking at that every day. With some of the variants, it's looking very promising in terms of vaccine efficacy against those variants. In other variants, for instance, the South Africa variant, it appears that the vaccines may not be as effective, but again, it has to be studied more before we can say for sure. And I'm sure Dr. McKinney can speak more to that.
Dr. McKinney, do you want to speak on that?
I do. Everybody's been reacting pretty strongly to this information that came out about AstraZeneca and the South Africa variant. To be honest, it was a very small number of people. I think the number was 44 who had that. And honestly, of those, none of them got severely ill, but there wasn't a difference in terms of rates of rates of contracting the disease between the people who were part of the treatment group and part of the placebo group. So it doesn't look any better or worse, but it's hard to say right now. And to be honest, most of the studies, aside from the AstraZeneca one, haven't really been studying things to that degree of detail yet. So there's really not a lot of data available as of yet. But the good news is most of the vaccine manufacturers probably will be able to pivot quite quickly and redesign the vaccine against the variants once they've had time to sequence the DNA and things like that.
And that's one thing I want to point out too, Brittany, is that the vaccine doesn't prevent you necessarily from getting COVID-19. It's known to prevent severe disease related to COVID-19. And I think that's a distinction that a lot of people have not really understood. You may still get COVID-19, you may have a mild illness, but it is 94 to 95% effective, the Moderna and Pfizer ones, at preventing severe disease related to COVID-19.
Okay, that is a helpful distinction. And so, given that this moment that we're in, I know, especially here in Minnesota, a lot of our scholars just went back to school at the beginning of the semester in January. And given that there are new strains of the virus and not everyone, is even able to get the vaccine, which we'll talk about in a little bit. And we'll also talk about the efficacy of the vaccine. But I'm wondering, from your perspective, Adriene, as a nurse and infection preventionist, specifically at the Children's Hospital in Minnesota, and then what's your thought on if our scholars should be back to school and if it's safe, given the fact that most of them have not been vaccinated?
We know that the measures we had in place before worked to stop the spread of COVID-19. So as long as they're able to wear their mask all day, do their hand hygiene, and keep the students far enough apart, I think it's fine. But we have to have those infrastructure tools in place to support our educators so that they can do that. And as long as they can do that, they'll be fine. There are several studies from CDC where they looked at different areas of the world, and they looked at, people who went to see a hairdresser or a hockey team. And, and what we're finding is that even in these large groups, if everyone is wearing a mask and doing hand hygiene and maintaining social distance, then you stop transmission from occurring. And it's not that you have a little bit of transmission occurring, you stop it from occurring. And so as long as we have everything in place to support our educators to do that, I think they're okay to go back to school, but we do need to make sure they can have the PPE that they need to protect themselves and the students, and make sure that they can keep the students far enough apart, during the day so that they are protecting themselves as well as the students.
And Dr. Nate, you're a pediatrician. What's your thought on how we protect our scholars in particular, and if it's safe for them to be going back to school at this point?
Yeah, I largely agree with Adriene in that it's, not so much a matter of, should they, but, how do we do it safely? That is the issue. And I think a lot of the studies that have been done in other settings, but as well as in schools, have shown that if our schools have taken the time to prepare, and so, having kids wear masks and get used to wearing masks and have that be part of your school culture, and making be multi-cloth layered masks, that makes a big difference. Having them distance, but actually then having them in a cohort, right? So like they're only around the same, 20, 25 students throughout their day, and not interacting with other students, and not interacting with other cohorts. That decreases transmission. Having supports for if a child feels ill, if a teacher feels ill, that they're able to stay home in quarantine, but continue to, if it's a scholar, stay up to date with the class and not fall behind, and have those supports in place, I think are all really important pieces. And so I think that's like where the conversation should hopefully be going, is that we know that education is really important for the health of our scholars, not only just the kind of education aspect and kind of growth, but I'm seeing a lot of depression and anxiety, particularly in older children in my practice, who have gone now for almost a year without that kind of regular social contact, the ability to kind of learn about themselves and grow in that setting, and that's really important, and that we all value. And so I think having the conversation about how do we get the scholars back safely, get our teachers back safely, not not making it a yes or no, but I think what are making sure we are making these steps to do it safely.
Yeah, you bring up a really good point about the mental health of our scholars, but let's be honest, it's impacting the adults in their lives as well. I think we're all missing that social interaction, and this is taking a toll on us. And I think when we do have these discussions about the reopening of schools, bars, nail salons, et cetera, it's important to take into consideration the rates of transmission as it relates to COVID, but then also what's the loss that happens? How does this impact us mentally, emotionally, spiritually, to not be able to go into our places of worship and fellowship the way that we used to, or to see our friends, to be able to hug our grandparents, things of that nature. So we're going to continue to unpack this vaccine and how we can get it. And I first want to ask Dr. Zeke, is the vaccine the most effective way to truly combat this pandemic that we're in? And how effective is it?
Yeah, good question. So to be honest, I mean, all of the measures Adriene mentioned, hand hygiene, physical distancing, wearing masks, are ways to prevent the spread of the pandemic. However, in addition, a vaccine is probably the most effective way, but we need to do all these things together. So, it's not enough that people get vaccinated and say, okay, I'm going to forget about everything else. We really do need to continue to practice the same principles that we have been to date. In terms of efficacy, this is where I think a lot of people are getting confused. Some of this Adriene talked about as well, but first of all, people have to think about, okay, well, does the vaccine prevent somebody from getting the disease? In general, that is never really 100% for any vaccine, and so I wouldn't expect that for these. And that's where I think the numbers that are being reported are making people think, oh, one is better than the other. But to be honest, that's not where I'd put my marker in the sand, at least not right now. Number two is, does the vaccine prevent people from developing severe disease or getting hospitalized or dying? That's probably the most important one, I would say, right at this moment. And for all the vaccines that are out there, it's close to 100%, as Adriene described. And even the ones that are in trials look pretty good. The third way, and this is also really important, and this is where we don't have a lot of information, is about whether the vaccines prevent transmission of disease. The AstraZeneca trial put out some information about a week ago showing that their vaccine is reducing transmission by about 2/3. That's pretty huge. And we're hopeful that the other vaccines are going to be equally successful in this regard, and that's why vaccines have been successful in the past. But ultimately, that's the information we're waiting for to get out there. So in terms of efficacy, I mean, honestly, they all are doing a pretty good job, but the numbers that have been studied, even in the phase 3 trials, are still quite small compared to the general population, considering that this disease is out there everywhere. So, when people get hung up on numbers like 70%, 80%, 90%, I'm not really worried about that. And so people say, well, which one should I get? I would say get the one that's most quickly available to you.
Thank you for that. There are 3 different vaccines that are available, the Moderna, the Pfizer, and then the Johnson & Johnson. Is that correct? Adriene, can you help us understand what is the difference between them?
Yeah, so the Johnson & Johnson vaccine is still going through the EUA process with the FDA. It should hit the market soon in the next week or so, or maybe sooner. For Moderna and Pfizer, they are both messenger RNA vaccines. And so what that means is that the vaccine it has a bubble, and that bubble has a message in it. And so the bubble carries the message. And once your body gets that message, reads it, and starts to develop antibodies against COVID-19, the bubble dissipates, it reabsorbs. And so it's a very effective way to deliver vaccines. It's a newer technology in that, people are more familiar with the egg-based vaccines that we produced, historically. But this is science that they have been studying and working on and using for other modalities for centuries, for decades. So it's not new to the world, it's new to the public. And they're very effective, I think, and I can't say for sure because we don't know the numbers, but I think it's just amazing that as we see vaccine rates going up, we are seeing COVID cases going down. We hope that that's related to vaccines combined with masking and hand hygiene and social distance. We won't know for sure until we, do some more studying and gather some more data. But so far, it's looking very promising.
Well, that's good to know, but I wonder with Johnson & Johnson in particular, you all know, and you'll probably hear her in the background at some point. I have a 2-year-old, I have a toddler. I don't even bathe her with Johnson & Johnson baby body wash. I don't put the powder on her. That's not a trusted brand of mine, given, their history and the lawsuits that they've had with powders and other products. And so it makes me wonder how, as the general public, can we trust them to now be manufacturers of a vaccine? And how is that even within their wheelhouse? If I decided I wanted to manufacture, a version of the vaccine, am I just able to do that because I'm an entrepreneur? How did they even get to this place?
Yeah, so that's a different division of Johnson & Johnson. Companies have different divisions and they're under the same name, but not the same umbrella. So basically, Johnson & Johnson provided the funding to create the scientific lab under their name, but the people that are working in this lab are, the same scientists and microbiologists that work in other labs. And so when you're looking at things like medication and vaccines, there is an entire set of guidance that has to be followed. There are tons of rules and regulations and, state and national guidelines that they have to follow in order to develop anything, but especially for vaccines. And for the COVID-19 vaccines, they all have to go through the same FDA emergency use authorization process. There's no cutting corners. There's no shortchanging. Their studies have to be conducted in the same manner. They have to go phase 1, phase 2, phase 3. And so what I want to tell people is if you distrust Johnson & Johnson as a company providing consumer products, know that there are less guidelines for consumer products than there are for vaccines. And so they're very different. For consumer products, you can pretty much develop anything, put a label on it, say it's safe, and bring it to market. Not so with vaccines and medications. And so with that in mind, I would tell people, trust the science, but do your homework. This information is public. For all of these vaccines, the information is public. You can go online and see the actual documents that correlate with the phase 1, phase 2, and phase 3 trials. You can see the results from those trials. If you read them and you don't understand them because they're very scientific, go to a trusted source like myself or Dr. Zeke, and let's talk about it. Find someone you trust that can talk about it with you and make it more understandable, because it is a very different process than they use for their consumer products division.
Now, is that the standard for the United States? Because we mentioned earlier there are different strains of the virus that are particularly coming from other parts of the world, like there's the South Africa virus, et cetera, and so, or the South African strain. And so I'm wondering, is the virus or the vaccine that we are receiving, is that the same vaccine that's being administered in South Africa, in Ghana, in China, or are these vaccines unique to the United States?
So each country purchases their own vaccines. And, there were 280 different vaccines in the pipeline at some point. There are probably 9 different vaccines that are being administered across the world right now. We don't have all 9 in the United States. The FDA only makes decisions about vaccines administered in the United States. So what other countries do, that is determined by them. And some of them have ministers of health that have to, kind of do the reviews. Some of them have committees that do the review, but each country is different. And so if they're getting the Pfizer BioNTech vaccine from Pfizer, then it should be the same vaccine. But there are other vaccines that they're getting. For instance, there's a vaccine that was created in China that is being distributed in Russia. And I don't remember the name of it, but we are not getting that vaccine here. So it really depends on the country and which vaccine they're getting and which company they're getting it from. And it's different depending on how their infrastructure is set up to review and look at the data from those vaccine trials. The FDA has a very systematic way of looking at vaccines. If you ever go through it, it will just blow your mind what companies have to go through. And some countries will look at the US and say, well, why are you doing all that? That's too much, it's overkill. And in the United States, we don't feel like what we do is overkill because we want to make sure that we're doing what's best for our citizens and making sure that we're protecting them. And so in some cases, our way of reviewing vaccines and the requirements that we have for vaccine companies is a little more stringent than other countries. So it really varies from country to country and from, company to company in terms of what is required and what kind of guidelines they have to follow.
Okay, so that opens up a whole new set of questions I have about, when we're talking about varying levels of efficacy when it comes to the vaccine. So it's like, what's the one they got in Russia? Is the one in Russia a little more effective? Or if it's less effective and, we're allowed to travel internationally the way that we were able to so freely prior to the pandemic, then are we at a higher risk of exposure because a particular country or geographic region has a less effective version of a vaccine? Like there are so many things that we could get into with that. And I just want to stress to the audience, this is a 2-part conversation. So we've got about 45 minutes left in this conversation. I'm looking at the chat and making sure that I am acknowledging all of your questions and that we're getting those answered. But if something does not get answered in this conversation, we are coming back 2 weeks from now to make sure that we continue to answer those questions. I want to pivot to Dr. Zeke. Let's talk about herd immunity for a minute. There's this concept that we need a certain amount of the population to become vaccinated or to boost their immune system. What is herd immunity? What does that actually mean?
Yeah, and to be honest, Dr. Nate sending in our private chat that I should say community immunity because, herd makes it sound like we're animals, and we certainly aren't. So
yes,
community immunity is really important because, and this is just in response to what I'm seeing going on in the chat here. It's the way that we're going to really stop disease spread once enough people in the community get vaccinated, because then even though the vaccines aren't going to be perfect at preventing disease, it will prevent disease for many people. And for those who get it, they'll end up being immunized or, maybe, not have a severe disease and, essentially the virus will die out with them as well. So ultimately, the physics of this is that once a certain percentage of the population, and for this virus, the prediction is around 70 to 80%, but it really varies depending upon how infectious the disease is. Once that many people are vaccinated, it becomes very hard for a disease to spread because it can't jump to people if they're already vaccinated. And so even though people are concerned about being guinea pigs or are concerned about, well, it's not going to totally prevent me from getting the disease, I'm going to make the argument your other option is just to get the disease and potentially have the severe consequences of having it versus having a vaccine. And, maybe you're going to feel crummy for a day or two, but at the end of the day, it most likely will protect you quite significantly from some of the worst outcomes of getting the disease itself, with the benefit of being able to then hopefully prevent the disease spread in the community. And so people in the comments are saying, well, gee, I thought if I get vaccinated, I could go see my loved ones. And I would say, well, if you're vaccinated and they're vaccinated and maybe a couple weeks has passed since that happened, that might be a time I would say it's starting to get possible to do that. But even still, it doesn't mean that, I'd recommend going to Target or Costco and walking around with a mask off. Not yet.
Thank you for that. For me, the biggest reason I am not saying that I am like for sure going to get the vaccine, but one of the biggest things for me is I want to spend time with my grandparents. And so if I would be willing to get it if that meant that I could sit in the same room with my grandmother and be able to hold her hand. But of course, then she would need to get the vaccine as well. But I also wonder, one of my best friends just found out she's pregnant. If I want to go spend time with her or even be in the room during labor and delivery, she's now not eligible to receive the vaccine because she's expecting. Is that correct?
Yeah, there only now are starting to be trials in pregnant women. One of my colleagues at Health Partners is starting to get a study going on that in the near future. And so that would be a case where we are still going to have to wait longer. But much to your point, I haven't been able to spend time with my parents in about a year. And I'm waiting for them to get vaccinated and I myself to get vaccinated. Well, I already am. But for them to get vaccinated before I can actually go spend time with them. So I think, in small groups, if you're in an environment where everyone's vaccinated, it's okay. I just did a diversity, equity, inclusion podcast with a couple of doctors last week, and we were in the room. We were all physically distanced, but we did take our mask off to record. But everybody in the room had been vaccinated. So in situations like that, we can start to change behavior a little bit. But until you're sure everybody's vaccinated and it's been enough time since the vaccine has been administered, I would still hold off.
And I just wanted to answer that question a little more directly about pregnancy, because that's a question I get a lot when I'm talking to parents about vaccination. I don't think we'll have a vaccine available for children, young children, for probably 6 or 9 months, just based on the process and steps that are ahead. And so in the meantime, the only ways we protect children is having everyone around them vaccinated. And so often, mothers of young children who might be trying to get pregnant or are pregnant are asking about the vaccine, the COVID-19 vaccine in particular. And so the American College of Obstetrics and Gynecology actually does recommend that you talk to your provider and that most women do get vaccinated if they're pregnant. Because, here's what we do know. We know that pregnant women are more susceptible to COVID-19 and they have higher risks just because of the changes in the body with pregnancy of complications from COVID-19. We know that Black and brown women who are pregnant are suffering more of those complications, just like every other part of suffering more complications that we're seeing in our communities. When it comes to pregnant women, they are suffering, Black and brown pregnant women are suffering more complications from COVID-19. And so there's real risk to COVID-19 while being pregnant. And so I think the conversations that are, encouraged are, what is your personal, health risk? Are there anything else going on in your health that might increase your risk for COVID-19 and complications from that while you're pregnant? What's the community risk right now? So what are the levels of spread in the community? What's your, risk because of your job? Do you have to work at a job where you're going to be at higher risk of exposure? And so I think there's a lot of, conversations that need to go into it to kind of debate or have that discussion, come to the decision on whether or not, as a pregnant person, the COVID-19 vaccine makes sense for you at this point. But, as Dr. Zeke's pointing out, we haven't had the rigorous studies that we've had for pregnant women yet. We have seen that there were some women who entered the COVID-19 vaccine trials who weren't pregnant or didn't know that they were pregnant, got the vaccine and found out they were pregnant later. And, it was a very small number, but there was no obvious side effects or complications related to that. So I think that's all to say that I'd really, encourage, those women who are pregnant, who are trying to get pregnant, to have that conversation with or breastfeeding is another category. There's a lot of questions and concerns about whether it interferes with breastfeeding. And at this point, we feel like, again, the benefits there outweigh any potential risks, known or unknown. But I think those are conversations to have with your provider, and not just say, oh, I'm pregnant, I'm trying to get pregnant, or I'm breastfeeding, I can't get it. I think you should have that conversation with your provider and go from there.
I just want to name, as someone who just had a baby and just finished breastfeeding a few months ago, and I have a lot of health challenges since having my child. With everything, I feel like nursing women and expecting parents are always told, oh, well, there's not enough research to know fully how this would impact. Like, we need more pregnant people in these vaccine trials and more research done to center how we keep our expecting families and nursing mothers pregnant, or how we keep them safe during their pregnancy or during their postpartum period, so that it's not just a conversation between you and your doctor. What if you don't have a doctor who you fully trust? There are a lot of reasons where I think a lot of people have distrust, whether it's from the virus or from the healthcare system in general. And it's really disheartening to hear. And of course, you all on this call have no control over that, but it's so disheartening to hear, oh, there's not enough research done. Well, all of us got here because somebody was pregnant. So I think we need to, as a society, as research institutions, do more to make sure that we really know how these things are impacting us. That brings me to my next question about just the trust in general. I want to go back to Adriene, who you've been vaccinated. So I want to hear a little bit about your journey before we bring in Lachelle. You were vaccinated, and we've talked at length on this town hall in previous episodes about medical distrust, about Henrietta Lacks, about the Tuskegee experiment. You actually had someone in your family who was a part of the Tuskegee experiments. And yet you still chose to be a part of the vaccine trial and to have your family involved as well. What was it for you that helped you to push past your fear or distrust, et cetera, so that you can make the best decision for your family?
Yeah, so, Brittany, first of all, I'm still sitting here with my heating pad on my feet as we speak because of the results of my grandfather being a part of the Tuskegee experiment. So it is real for me. But I read the information. I Googled Pfizer, BioNTech. I read the studies. They were very scientific. I was a little confused, even though I work in infection prevention. It is still a lot to take in. I read newspaper articles that explained it a little bit better in the New York Times and the Washington Post, because they do a really good job of taking really scientific information and making it understandable for lay people. And then I had a conversation with my director, who happens to participate as an ad hoc member on the vaccine information committee for the CDC. They make all the vaccine decisions for the country, and she is an ex-member of that committee. And so I trust her with my life and with my kids' lives. I've said that before. And so we've had multiple conversations about it. Being a part of the trial was a no-brainer for me, because I know that part of the problems that Black and Brown people experience with anything is because we don't participate in the trials. If we don't participate in the trials, we don't know how things are going to impact us. I've told people about this when I was living in Atlanta. There was a study on hypertension because there was a first-line drug that was being used to treat everyone with hypertension. It was a great drug. It worked really good. This is the first one we're going to use to treat everybody that has hypertension. And it was causing kidney failure in Black people. And they didn't know why, because we were not a part of the trial for that drug. And so if we want to build more trust in the healthcare system, we're going to have to participate in it more. So that is why I participated in the vaccine trial. My daughter decided on her own. I asked her initially and she said no. And I was totally okay with that. She's 21, she can make her own decisions. And then after hearing me talk about it so much, she decided on her own to participate. And it was wonderful because it was something that we were doing to give back to our community. And when people ask us about it, we can actually talk about what's really happening with us, and we're not talking in theory. We're not saying what the science says or what the doctors say. We're talking about from our own experience. And that's been wonderful. I love having conversations with people about how we're dealing with it, how we participated in the vaccine trials. And now I actually just got unblinded in the study that I was in because I had the opportunity to get vaccinated at work. And so once they unblinded me, I found out that I indeed did receive the placebo in the vaccine trial. So I got vaccinated against COVID-19 on Monday. And, the only side effect that I had was my arm was pretty sore for about a day and a half. But other than that, I had no other side effects. I was fine. I got the next day and I still worked. And there's side effects vary from person to person. Some people have been in the bed for a day. Some people are fatigued. They have body aches. It varies, but these are things that you can deal with, because for me, it's, do I want to live or do I want to risk dying? And that is really what it comes down to. And unfortunately, it has hit home for me because my godson's grandmother died last week from COVID-19 complications. And we were supposed to go as a family to California to Christmas because we spend every Christmas with them. And we were unable to go just because it was too busy during that season and I didn't want to travel. And because of my son's immune system and the fact that he doesn't have the protection that we have because he has a weak immune system, I didn't want to risk it. And someone had COVID-19 and was around the family. And the family got it, and mommy died. And so now I'm flying to California next week to go to her funeral, when all people had to do was wear a mask and keep their distance. If you don't feel good, stay away from other people. It's that simple, And so now my children have lost another grandmother because she was a grandmother to my kids. My son, who is special needs, absolutely loved her. Her and daddy just loved on my kids. And my son felt so special with them. And how do I explain to him that because people didn't care about doing the right thing, that his grandmother is gone? And it's just heartbreaking. She was in her 70s, but she was full of life and she was full of energy. She cooked for us every time we went to California. And now because somebody didn't feel good and they didn't see the need to do the right thing, she's gone. My real mom is dead. So, she was my mom. And now I have to go and say goodbye to her because somebody was irresponsible and didn't care enough about other people's lives to do the right thing. And so that's what it comes down to for me. I was happy to get vaccinated. I can't wait for my son to get vaccinated. He's been in the house with no social life since August because I can't risk his life in the community. And the community is not doing what they need to do to protect him. So I have to keep him home. And he is tired of being home day in and day out. And so I want people to understand this is real. This is not something that happens to other people. This is what happens to us. Mommy was Latino. Black and brown people are the ones that are dying at the highest rate. We are the ones that are getting severely ill at the highest rate. And we have to stop saying, I'm not going to because I'm afraid. We have to say, I'm afraid, I'm concerned. However, I'm going to make an informed decision and do what's right for my community. Otherwise, it's not going to get any better for us, and it's going to get better for everyone else like it has historically.
Well, Adriene, thank you for sharing, for your honesty and your transparency, and you have our deepest condolences. I appreciate the spectrum of experiences that you bring to this town hall every week. Everyone loves to point to, and rightfully so, the Tuskegee experiments, Henrietta Lacks, Black infant and maternal mortality, the disparities of COVID itself and how it disproportionately impacts people who look like us. But sometimes hearing the numbers and even watching the town hall, it doesn't truly land until it's someone that you love who's lost, who will never come back as a result of someone else's negligence or lack of information. There are things that we can do. I want to encourage people and not to say, because again, the virus isn't, or the vaccine is not the 100% way to prevent you or your loved one, but it does decrease your chances significantly. In addition to practicing social distancing, wearing a mask, practicing hand hygiene, there are things that we can do to ensure that our loved ones are safe and are healthy. One of the things that we can do is lean on our historical, ancient, cultural traditions, however you want to call it, and really doing the work to boost our immune systems naturally. I know for me, given my pre-existing conditions, I've really been leaning into food as medicine. And I want to bring in Chef Lachelle Cunningham to speak more to how we can be taking care of ourselves and leaning into natural healing practices. Because let's be honest, not everyone is going to get vaccinated. And we'll talk a little bit about accessibility. Not everyone can get vaccinated, at least not yet. And so in the interim, in addition to the measures that we've already mentioned, how can we be using food as medicine and other natural practices to ensure that we're boosting our immune systems and keeping our families safe? Chef Lachelle, are you there?
Yes, I'm here. Thank you. Thanks for
Thank you.
Yeah.
Thank you. Thank you for being here. I want to ask you, what is the connection between food as medicine and the ways in which we've healed ourselves historically as a community?
Well, I mean, that pretty much goes back to as far back as we can go with humanity and how we've, how we first started out having, being more on a what I would call indigenous paradigm where we're thinking and being in harmony with nature. Nowadays, well, first of all, I have to say this because food as medicine and let thy food be thy medicine are the words of Hippocrates. And as we know, that's the Hippocratic oath that that all doctors have to take when they go into this field. And so when you think about who said that, and what that means, I mean, that goes back so far as like people observing how they interact with nature and how nature is healing to us. And so, these go back to every indigenous tribe that you can think of. And specifically, us being African American in the African American community, we have a mixture of a lot of things, but a lot of that does go back to African and Native American indigenous practices and thinking about how what is actually around us in nature and how we utilize those things to heal us. And that was the foundation of traditional medicine and the segue into what we think of now as modern Western or modern medicine. A lot of that came from synthesizing what plants are doing, and still a lot of it comes from synthesizing what people were using plants to do for healing. And so, looking to that, and thinking about now, it's kind of cool or a fad or a trend to be healthy now. People are thinking, and especially since COVID-19, interest in health and wellness has gone up. We've been hearing for years about mind, body, spirit connection, about now the whole terminology people think of as mindfulness and trying to find this balance between, all of these different aspects in our life. And so when it comes to boosting our immune systems, we have to, I think, figure out what that balance is between what we know now and all the studies of modern medicine, but also what are those traditional things? What were those ways that people were using to heal themselves? I would say, there was a part in the conversation of talking about the vaccines and how they're different based on geography. And that also has everything to do with our immune systems. Our immune systems are based on our geography as well. And so when we are connecting with nature in our local community, when we're growing our own food, when we're foraging in our own communities and backyards, that is helping our immune systems, because the plants that are in our local environment and different what we call adaptogens and ways that the plants work are actually more effective in our local community, rather than if we were to buy some herbs from across the globe. So we need to think about buy herbs or even fruit and vegetables, buying locally, growing our food locally. These are all things that help to boost our immune system. Having that balance of what we're actually consuming in our bodies, we can put a vaccine in our bodies, but how are we living well every day to prevent disease? What are we putting in? What's the air quality that we're breathing? What's the environment that we're in? Is it a stressful environment? Is it an oppressive environment? Are we getting enough sunlight, vitamin D, all of these things? And then water, air, environment, then what are we actually consuming into our bodies, into our minds? What are we on social media and the way that we're living now? What is the intake that we're taking in? Because all of those things have something to do those stress levels affect our immunity. Then when we get down to the actual diet, right? What are we putting in our bodies? What's the balance of health? You know, we have so many different diets now. There's extreme veganism, and then there's extreme carnivores, and then there's the keto and all of these different diets and things that our people are doing. But how is that creating balance in our lives? And it's not just about subscribing to some diet. It's really knowing your body, knowing yourself, because what is good for me might not be good for you. If I have an allergy or a food sensitivity or something that I'm eating is causing inflammation in my body, that is also going to impact my immune system. So thinking about what is the diet that I need that's customized to me for my personal health? What are the vitamins and the minerals that I need? Do I need to always take a supplement to get those? How much of that can I actually get if I just eat fruits and vegetables and other foods and legumes and things that have those vitamins and nutrients? And the uptake into my body is going to be a lot more efficient, because that's what I'm supposed to do, is eat food, not take necessarily chemicals into my body. And so thinking about all that, the micronutrients that we get from herbs and spices, those things are vital for us. And I'm not a medical doctor, but I know my body, and I know how my body reacts when I eat certain things versus other things, and how I feel more energetic, alive, and my immune system being boosted. I study herbs and plants, so I do know, and I have witnessed in my own body and my own experience where I have used herbs and certain foods to help heal myself from certain ailments, or to decrease the symptoms, or to treat certain things. And so, we have to figure out a balance, I believe, between traditional medicine and all of these ancient practices that we that have honestly in a lot of ways been forgotten, and a balance between what we know in modern medicine and how we can benefit, and what's the balance between these two. And I know there are studies, and there are a lot of traditional practices of traditional medicine that are being used in different countries, incorporated with modern medicine to try to curb these symptoms of coronavirus. I know in China, I know in Zimbabwe, there's been some different things that have been going on that I've learned about, just in using traditional medicine practices and modern medicine practices. And so that's what I would say about boosting your immune system, and really what is that balance, and how do we not lose all of that knowledge? That's not just, necessarily strict medical knowledge, but what do we know about our environment and the foods and the things around us that we're consuming, and how can we change that to improve our health? And so that's just a personal question that we all have to ask ourselves and understand, because it all starts with our choices ultimately.
Absolutely. And I love the point that you make, that it doesn't have to be an either or, right? But that we have options and we have choices, just as well as you can go and get the vaccine. It still matters what you go home and eat, and the ways in which you practice hand hygiene, your social distance, et cetera. And so thinking through, what are a few foods, herbs, macronutrients, whatever, that you would recommend that people maybe do some research for themselves to see what works? Would it be elderberry syrup, bladderwrack, sea moss we were talking about yesterday.
Yeah.
What are a few things that you recommend people start researching and kind of figuring out for themselves, or even consulting with a medical doctor on?
Yeah, I think what people need to start with on an individual level is trying to figure out what are the foods that cause you inflammation in your body, and that you can go to your medical professional. There's other services that do some sort of allergy or food sensitivity test. That's just a good way to start, I think, for everyone to understand what things, again, are going to cause that inflammation and what things are going to actually help you nutritionally from that standpoint. But if you want to think about specific things, I think one of the number one things that we all need, especially where I'm at in Minnesota, is vitamin D. Is a big one that people should look more into. And I know that there's been some use of that in studies looking at how much vitamin D, and of course there's always conflicting opinions on everything, but people can do their own research about vitamin D, vitamin C, and those are things that you can get. Now, vitamin D, you're not going to get as much from, you get that from sunlight, right? So that would be one I would recommend, me personally, people do as a supplement. But most of our other vitamins, unless you're a vegan and you need to take a B12 supplement, we can probably get from our food, right? So if I want to get more vitamin C, I can eat more oranges and citrus fruits and green veggies that provide those things. When it comes to like herbs, something that I use pretty regularly, if I ever feel like I'm getting some sort of a cold symptom, I take echinacea and golden seal. They're not meant to be taken continuously, but my experience has been, if I take them immediately upon feeling symptoms, my symptoms are eliminated or they don't worsen and they get better over time. And so echinacea and golden seal are herbs. Now, all of these things, these are herbs that I'm recommending. I'm not a medical doctor. I'm not, there's studies and research that people should do about this and probably test things. Don't just take things in large amounts before you start utilizing these herbs. I use a book called The Prescription for Nutritional Healing. And this is a great resource that I use often when I want to look up and learn more about different ailments and different natural ways through nutrition and herbs and things like that to help to deal with certain ailments that I might have. In addition to that, I mean, there's a lot. I think it's more about balance and making sure you're getting all of your nutrients and that you're not deficient in the nutrients that you need on a day-to-day basis. And then using additional herbs and spices like, something that helps reduce inflammation. A lot of people talk about turmeric a lot and how important and how there's a lot of antioxidant powers. And so looking at what are the antioxidants in the foods we're eating, a lot of, fruits and citrus fruits and just fruit in general has a lot of antioxidant properties. Vegetables have a lot of antioxidant properties. So how can we get more of these in? Now, a lot of people always think that because we're talking healthy, that we have to sacrifice flavor. That's the opposite of what I believe. And I honestly think you can get a lot more flavor out of fruits and vegetables than you can get out of a lot of the other products that aren't fruits and vegetables. You just kind of got to embrace that as a part of your life. It's important to think about what we put in our bodies. Now, the other issue about that is something that you mentioned about people's access to having access to even have access to the vaccine, but also do we have access to health? Do we have access to healthy fruits and veggies? In certain communities, all we have are convenience stores on every corner and liquor stores on every corner. So we don't have access to fresh fruits and veggies or local produce. We might not even have a backyard where we can grow our own vegetables. So how do we as a community come together and think about how we can provide those things collectively? And there's a lot of work in the food justice area. There's a lot of urban farming is we've all heard of it, right? So it's happening, but we all have to have a responsibility to think about how we can plug into that and also extend that to other people that might not have that access. And we have to think about how that is going to happen. So. Did I answer your question?
You absolutely did. And you bring up a really important point about the access to healthy foods. I had a procedure done yesterday. You and I have talked a little bit. I've been having all of these different health issues. And afterwards, I'm like, you know what? Let me go to the co-op so I can get some of these healthy things that this medical professional just recommended to me. And the co-op wasn't open. They closed early. So I ended up having to go to a different store. I ended up going to Hy-Vee, but Hy-Vee is a little more expensive than like a Cub or an Aldi's or other things. And depending on where you live, it may not be accessible. And so whether it is growing your own food or just learning how to cook healthier foods, or if you're really interested in learning about food as medicine or leaning into the culinary profession, you have a variety of programs and services that you're offering, some of them even free, specifically for Black History Month. We had your website going at the bottom through the ticker. And I just want to remind people, LachelleCunningham.com is the website where they can go and find more information about you. And we'll make sure we put some information in the chat as well about the programs that you mentioned, everything from the cooking courses to storytelling through food. I know as I'm learning how to cook, I'm really into the plating, making it look cute, as well as making sure that what I'm eating, everything that I'm eating now has to be intentional and has to be helping me towards my healing journey. So I know that you actually have to go because you're getting ready to do one of your programs in a little bit, but I want to thank you for your time and your thoughtfulness. Was there anything that you wanted to share with your audience before we let you go?
Yes, definitely check out the website. I am building a Healthy Roots Institute full website dedicated to that, but that's still in development. You can learn more about the Healthy Roots Institute on my website now, as well as if you follow me on Facebook or Instagram, Facebook probably more than anything, you can learn more about the classes that I offer. I do have one coming up, a free virtual class on December 16th through the Good Acre, which I work as the culinary education manager. And we're going to do a Discover class called Beyond Soul Food. And that's where I dig into talking more about the history of soul food, but also really the health and the nutritional healing aspect, and really digging into the history, social justice, and we end up making a really awesome plant-based soul food dish. So we'll be making vegan po' boys that day on the 16th. So it's free, like I said, from 5 to 6 on the 16th. And again, check out my Facebook page to learn more about my other upcoming classes. It was an honor to be here. Thank you so much. I really appreciate learning so much from the other panelists, doctors on the panel, and medical professionals. I appreciate all you all do. And thank you so much for having me. I'm going to make jerk shrimp and grits for a soul food class right now. So thank you.
Okay. Excellent. Well, thank you. Save us a plate. I mean, I know I'm vegan, but as you mentioned to me a few days ago, you don't have to be like fully vegan. You can have a plant, but so I might have to have a cheat day and come have some of that as well. And we just want to name, these practices, long before we adapted into the culture of Western medicine, it was the healers, it was the herbalists, it was, our community nutritionists who kept us healthy. And so thank you for keeping those traditions alive and for making space for our conversation, not to be an either or, but a both and when it comes to holistic wellness. And enjoy your class. I want to pivot back to Adriene, Dr. Zeke, and Dr. Nate. And let's get back into this conversation about the vaccine. Lachelle brought up a really important point about access. There are quote unquote food deserts everywhere. And just as there is a lack of access to healthy foods and herbs and things of that nature, there is a lack of access when it comes to this COVID-19 vaccine. We couldn't all get it if we wanted to. So what is the deal with who can get the vaccine? Is it a matter of being insured? Is it because you're elderly or you're a frontline worker? Who can get the vaccine right now and where?
So
yeah,
go ahead.
Okay. So I'll take a crack first because I'm actually on Minnesota Department of Health's Vaccine Allocation Advisory Group. And so we've been talking for some time since September about knowing that the vaccine was coming, that it was likely going to be a scarce resource, meaning there wasn't going to be enough for everyone to get it right away. And so how do you ethically and equitably give out that scarce resource, right? And so the initial phase that was announced in December, phase 1A, was targeted at the frontline healthcare workers to try to make sure our hospitals kept open through the surge that we saw around the holiday season. And then to those who are at highest risks. And in our community, we know that those in long-term care facilities, nursing homes, had seen some of the highest rates of death from COVID-19. And so those are the two groups that were selected for that phase 1A. And then the plan was phase 1B. So once all of those individuals got the vaccine, or at least offered the vaccine, then the next phase 1B would continue down that line of those two categories. Who's most at risk, from dying or the most severe complications of COVID-19. And so we know that the older you are, the higher you have a risk of having these severe complications. And then who's, really essential to the functioning of our society and keeping everything open. And that's those other frontline essential workers that aren't just in healthcare, but are helping in so many other areas like teachers, but also like grocery store workers and food manufacturing, public safety and public transit employees. And so that was really the plan, to target those communities specifically with the age, initially from the federal guidelines initially was 75 plus. But right before the Trump administration left, they changed it to 65 plus, which opened it up the door for a whole, bunch more people to feel that they're at the front of the line, but there wasn't the additional supply. And so we find ourselves in this place where there's a bunch of people who think they're at the front of the line. The supply isn't there. And so there's this mismatch. And additionally, we haven't done a significant amount of change in our delivery systems. We're still using, primarily clinics. There's been a couple large scale vaccination sites, but you have to be able to log on. And at first it was a first come, first serve. And so it's kind of like trying to get PlayStation 5, like you just trying to bounce around to different websites and see if you could log on and get access that way if you were 65 plus. And then they changed to a lottery and kind of try to, again, but you still have to, be able to access it through these online portals. And so they're still working on it, and we've been pushing them to try to think more outside the box, because basically we're doing what we've done before, which, this leads into all those issues that you brought up, Brittany, and that the chef brought up about access. And we know that, our communities already have barriers to just general healthcare access, whether or not they have insurance. They still have access to getting to clinic, getting time off from work, concerns about costs, things like that. When it comes to cost, the good news is that the shot and the visit for the shot, so going to see a doctor or nurse for the shot, is covered. And, there's federal legislation or federal rules that are saying that there should be no cost associated with getting the shot. And so, hopefully we get that information out more and more that, that there should be no cost. And then hopefully we continue to build up, supports for transportation. And we're trying to talk to employers about getting supports for, paid time off and things like that. I think Target just announced that they're going to do that for all their employees. And so those things are coming. But for now, it's 65 plus, and then teachers and some childcare workers are also were included in some pilot. And so if you're in those two categories or those three categories, that's who really has access, in addition to that first wave, which was healthcare workers and those in nursing homes.
So then it makes me wonder if educators and daycare providers are able to get the vaccine. What about our babies, though? Do you see our young people under the age of 18, especially if they have, if they're high risk, if they have other pre-existing conditions, do you see them being the next wave of people who are prioritized? Like who will get access next?
It's a great question. We're still waiting to reconvene as the advisory council to kind of look at that and give those recommendations. Kind of the national frameworks that were set out in the fall, talk about moving down. So once you go through the 65 plus, you go to the 16 to 64 as far as the age range, and you look at those with pre-existing conditions who do have some things like diabetes, hypertension. asthma or COPD, HIV, or other things that impact your immune system. And so having individuals with in that age range of 16 to 64 who have those pre-existing conditions be prioritized before a completely healthy person in that age range. And then also looking at other, continue to look at other essential workers who can't avoid the exposure risk because of their jobs and how they come into contact with others in the public. And so those are kind of like the next line. And then it would likely be opened up to everyone. Right now, the shots we have, the Pfizer shot is approved down to age 16, but we don't have any shots younger than 16 that are approved. Their studies have just started within the last month or two to look at younger children, and so that's why I've been telling parents I don't think we'll have a shot that goes through all the studies and all the process that Adriene did a great job kind of detailing the rigor behind. I don't think we'll have a shot available for younger kids, still for another, 6 or 9 months. And so again, the way we protect them is by making sure all the adults in their lives get the shot and continue to, follow the public health guidelines to decrease risk of spread.
And you also mentioned the shot being covered, but I'm wondering about for those who are uninsured, then what happens? Because it's a global pandemic, so it's going to impact all of us, whether we like it or not. If I'm not insured, but let's say I'm homeless, to me, that's someone, if you don't have a permanent home, you're at greater risk for transmission than someone who does have a consistent home that they get to return to every night. And so what's being done to mitigate the barrier for people who may not have Medicaid or some type of insurance?
Yeah, it's a great question. And that's another category that we talked about as advisory group and recommended be amongst the considerations for prioritization right now is those who are in prisons and jails and those who are in homeless shelters, basically other congregate settings where you're around lots of people and it's not really a choice of your own. And so, but you're at higher risk. And so getting shots into those communities. And there's been some early efforts to try to get shots to the shelters and have them distribute them to the guests at those shelters. It's similar to testing, right? So testing was made free for everyone. And so, if you go through any of these large public testing sites through the state. And that's kind of the idea here with the immunizations is that they'll be, covered for everyone. I think there is one, wrinkle that we're still working on, and that's those in our community who are undocumented, just because of some of the rules around how you fund things, funding it through programs like Medicaid, ties your hands around getting it to those in our communities who are undocumented. But as you said, this is a global pandemic. We need to find ways to get this available to everyone that wants it, no matter your documentation status, no matter your insurance status. And so those are some of the things we're continuing to work on. But, the goal is that when those more and more of those folks are available or able to get it, that cost isn't the barrier.
And where can people go? We're running out of time here, so I want to know, where can people go to find more information if they want to know about coverage or just when they'll be eligible to receive the virus, how they get on a waiting list of some sort? Do you have a number or website that you recommend that people go to?
Yeah, so the state's website is mn.gov/COVID-19. And so that's a good place to get information about the vaccine, about who's eligible. There's even a website that just got launched last week to look at the different testing sites for those who are 65 plus. There was just a partnership with Walmart, Walgreens, and then one of the other pharmacies that's kind of up in more rural Minnesota. So there's going to be more options for those elders in our community to get access that way. And so that's a good first place to start. And then I know I've been really plugging the ALF's COVID-19 hotline for our Black community, and I anticipate that they'll continue to be linking those type of resources there too. So another good place for our community.
Absolutely. I want to pivot to Adriene now. Adriene, are you still there?
I am here. Yes.
Good. Okay. So tell us. I know we're running out of time, but Children's administers vaccines. So who can get it, and what is the process for learning more information about accessibility and eligibility?
Right. So right now we are still focusing on our healthcare workers. We did have one vaccine where we day where we invited the public, and we will be administering the second dose to people who came to that clinic. We are in the process of setting up some additional infrastructure to be able to support the community. And once we have that set up, we will be adding community clinics, and that information will be posted on a Minnesota Department of Health website.
Perfect. Let's see here. I'm just checking my notes here. Dr. Zeke, are you there?
Yes, I am.
Excellent. All right. Well, what resources from the health partners' perspective are available as it relates to the vaccine, its eligibility and accessibility?
Yeah, I mean, I think Dr. Nate and Adriene covered it pretty well, but what I will mention is even more than the parameters that are laid out by the state, being over 65 or within various priority groups based on employment or exposure, some health systems, because of limited access, aren't offering it other than to people over age 75. And so it seems like, and this is just from my own looking through it to help find my parents a vaccine, that various health systems are at least initially limiting it to, people who are already their own patients there. And so, again, you're going to have to look either both at the eligibility through the Minnesota Department of Health or with your own individual health system for what their routes to get vaccinated are. But at the end of the day, pharmacies are getting access to this now too. And so you may want to check with your local pharmacy, whether it's Walgreens, CVS, a variety of other locations, because you might be able to get access there. Again, still mostly for people over 65. Or check with your employer to see if maybe they'll be getting it for you if you're a frontline or essential worker in that regard.
Got it. Thank you. My final question for you, do you play all of the instruments that are behind you?
A little, but not well. But, I felt like during this pandemic, when I'm on Zoom meetings or in front of the computer so much, keeping them closer to my desk would make it easier to take a few-minute break.
I agree. I used to have a guitar behind me for the town hall for a long time. I still can't play it, but it's one of those things where we have to tap into the things that we love and make the most of this pandemic, because we're going to be in it for a while. So thank you, panelists, for your time and all of the information that you have provided on today's town hall. I want to thank everyone who's been watching and commenting in the chat. Again, this is part one of a two-part conversation. So if your questions didn't get answered, or between now and our next conversation, if you find yourself having more questions about how you can keep your family safe and make an informed decision on if the vaccine is for you, we're going to have another town hall. I see in the chat, Dr. Nate said we need a town hall concert, and I wholeheartedly agree. We've had several very talented panelists on. And speaking of talented panelists, we're going to have an extra town hall. We typically do this every other week, but next week we're going to have a special episode of Black Life Amplified, and it's going to be focused on the By Any Means Leadership Conference hosted by the African American Leadership Forum. So you're going to be hearing from some of the panelists who are going to be speaking at the upcoming By Any Means Leadership Conference. So you don't want to miss it. It's incredibly talented group of people. It's all going to be happening virtually. If you want to register for the conference, you can do so on the African American Leadership Forum's website. And of course, if you want more information about the town hall, we are here, same time, same place, 11:30 to 1 p.m. Central Standard Time. Before I get out of here, I want to give a special thank you to our sponsors, North Point Health and Wellness, the Minneapolis Foundation, Children's Minnesota, for making this town hall possible. And of course, all of our partner organizations who come together and produce this thing behind the scenes. There's so many beautiful, amazing people who really help hold this together, and most importantly, keep me together, because I'd be all over the place. But special thank you to ALF, the Minnesota Spokesman Recorder, Children's Minnesota, Insight News, Minnesota Community Care. My name is Brittany L. Wright with Insight News. It's been an absolute pleasure to share virtual space with you all. Until next time, please take care of yourselves. Do what you can to keep yourself safe. And most importantly, don't go endangering the health and safety of other people. Be responsible, and we'll see you next time. Take care. Thank you.